The path is not in the sky, the path is in the heart. In acute hypoxemic respiratory failure, effective oxygen delivery is critical to outcomes. A new trial examined the efficacy and safety of high-flow nasal cannula oxygen delivery compared to standard oxygen therapy. This multi-center open-label trial included 116 patients with arterial oxygen to inspired oxygen ratios of 200 or less, randomized into two arms for high-flow and standard oxygen therapy. The monitoring period lasted 28 days. QuickTake: high-flow nasal cannula oxygen delivery compared to standard therapy in acute hypoxemic respiratory failure. Mortality at day 28 was identical between groups at 14.6%, with no significant difference noted. Intubation rates, however, were lower in the high-flow group at 42.4% compared to 48.4% in the standard group. Adverse events included a higher incidence of cardiac arrest or pneumothorax in the high-flow group at 2.3% versus 1.1%. The authors conclude that while mortality was unaffected, high-flow oxygen reduced intubation rates. QuickTake: identical mortality, lower intubation rates with high-flow oxygen, higher adverse events reported. Short quiz, clinical vignette. Question: a 54-year-old male presents with acute hypoxemic respiratory failure and a respiratory rate of 28 breaths per minute. His partial pressure of arterial oxygen to the fraction of inspired oxygen ratio is 190. Based on this recent trial, what is the most expected clinical outcome with high-flow nasal cannula therapy? Option 1. Increased reduction in mortality by day 28. Option 2. Reduced need for intubation compared to standard therapy. Option 3. Increased risk of serious coronary events. Option 4. Higher likelihood of developing pulmonary embolism. The answer is option 2. Based on the trial, high-flow nasal cannula therapy showed no significant reduction in mortality by day 28, but did result in a reduced need for intubation compared to standard therapy. There was a noted increase in adverse events, but primarily related to spontaneous breathing complications, not coronary events.